some of the things that we have also seen as a ministry or as a portfolio committee, and we have felt that they need to be looked into. It is, for example, the issue of centralization of user fees, that if people visit a public health institution and they pay, those resources, they cannot use them. They have to go to a central fund of some kind. They have to go to Treasury first before Treasury can disperse. It creates problems. It creates challenges around first of all access to cash and things that respective institutions can do. We visited a hospital in Matabele South and found them without brooms and mops. And before this centralization of user fees was there, these are the monies that they used to do that. But now they have to get every single cent that they get, take it to Treasury, and then Treasury disperses. And when Treasury disperses, it disperses through, they have to pay through that online platform. And this is a hospital deep in rural areas, and they are paying their suppliers who are also in rural areas. And the use of that online platform creates its own problems. So I think that structure needs to be changed. Here and there, we always push for better disbursement of these funds or that one. But directly within the ministry, as a portfolio committee, we haven't found much. We still think that we need to push more on the side of Treasury, where, for example, we ask, how much sugar tax have you collected during the course of this year? And you then go to the financial statements of companies that have to pay sugar tax. You go to Delta, you go to this one and this one and this one. When you read their financial statements about how much sugar tax they disperse to government, and then when you go to government to ask how much sugar tax have you received, there are discrepancies in those figures. And I think it will be important even for you as the fourth estate to assist us also in bringing together that information, because some of us will be doing it on ad hoc a kind of basis, because we are worried. We want sugar tax to move from Treasury to go to the Ministry of Health, so that it can deal with both the curative side of non-communicable diseases and the preventive side of non-communicable diseases, that public health education and so forth and so forth. So these kind of discrepancies, we see them, but they are at the level of things that happen before money gets to the ministry.